Let's talk about vaccines and vaccination. Many parents do not believe in vaccination or in vaccinating their children. It has caused some controversies. In fact, I've met parents who deny their children vaccines. What are some vaccines that are relevant for the safety and well-being of children as they grow?
Yeah, thank you very much for that question. Most of the time, I get this question, both from parents as well as from concerned individuals. Vaccines have transformed the world in the last 100 years. Antibiotics also have done the same, Yes, people these days want to refuse vaccines, and personally, I have to educate the families on the advantages of vaccines. These are medicine-like substances that have things that can make the body think there's an infection. In other words, the components of the vaccines look like some parts of the things that actually cause sickness. Now, those components are the things that the body normally will see and know that there's an infection. So once the human body notices something that looks like that germ and attacks it the first time, any other time it sees something that looks like that, it will trigger the reaction of trying to mop it up. So what vaccines do is to kind of do a boot camp for the human immune system, so that the human immune system can get to action immediately if it ever comes in contact with something that looks like what it saw in boot camp. So the boot camp was the vaccine shots that the children got. But in real world scenario now, when the actual agent gets in contact with the child or the adult who has been immunized, the body doesn't have to be wondering, what is this? Is it a germ? Is it not? The body already has seen this in boot camp. Yeah. So the body jumps into action and mops it up. So I can tell you for a fact that oftentimes we come in contact with many diseases that we were immunized against. Okay. And we don't even know it's come and gone because our body mops it up before it can even multiply. Okay. So that is the fundamental advantage of vaccines. Okay. And once parents understand that, they'll think twice about rejecting blanket all vaccines. Now, having said that, how do you decide which vaccine to take, which one not to take? The US government, as well as hundreds of other countries' governments, have spent a lot of money conducting research, paying people. People have spent 15, 20, 25, 30 years of their lives trying to find out one vaccine or the other to prevent death or debilitation, as in severe injury and helplessness and chronic illness in people. Some of these germs cause death, blindness, deafness, paralysis, and many other complications. But the biggest one is that many of them are childhood killer diseases. Okay. So they actually kill people.
The vaccines?
No. Okay. The infections they prevent. Mm-hmm. So because these infections can kill children, the vaccines are there to prevent the children from dying. Every nation prides itself in the number of people they have in their country. Yeah. So it's illogical for people to get up and say, oh, my government wants to kill all of us. One thing we know is that the government wants us to pay our taxes. They don't want to kill us. They want us to, help run the country. So no country wants to kill its own citizens. So governments will not fund things that will destroy them. That's why you see, even in places that are anti-West, they still vaccinate their children. So that will tell, they will still take those vaccines and give to their children because nobody wants their children to die. So the next time you want to refuse a vaccine, please ask the person advising you whether they have treated anybody ever who had any of those conditions that the vaccines prevent.
Okay.
If they have not, I don't think you should be listening to them. I have treated literally every condition that is prevented by these vaccines. I have treated them. Measles, mumps, rubella, varicella, meningitis, pneumonia, hepatitis B, you name it. I've seen children with those conditions, even tetanus. So don't refuse vaccines. They prevent death or debilitation in children. It's very important to get your children vaccinated. And if you want to find out more information, go to the cdc.gov website. Go to the World Health Organization website. So if you think our US CDC is maybe not, is doing just what our government wants, go to an international body like the World Health Organization and find information about vaccines before you refuse to protect your child. Right now, in some parts of the country, there's a measles outbreak. Reason, because many families have been lax about getting the measles vaccine for their children. And I believe some children that contracted the measles are either very sick or may even have had some unfavorable outcomes. So vaccines are very important. They should not be refused or rejected.
Okay.
The basic routine childhood vaccines, that's what we're talking about. The vaccines we give at birth, 2 months, 4 months, 6 months, 1 year, 15 months, 4 years, 11 years, 12 years, 16 years. Those vaccines are very important.
Okay.
They protect our children.
Okay, I'll come back to those vaccines again. So let me tell you, I just want to clarify something. So during my pediatrics clinical rotation, I met a mom who refused to vaccinate her child because her claim was that she gave her first child vaccination and that child developed deformity, and for that reason no more vaccination for any of her children. Do you believe that vaccine of any type would cause deformation in children or mental health issues in children?
There are always outliers and unusual cases, but correlation is never causation. So that, for instance, I'm originally from Nigeria. So that, say I have an uncle who comes to visit me in the US and falls ill, that doesn't mean nobody should come visit me again from Nigeria because they will all fall ill when they get here. And then coming to something even more fundamental, that little Mike, I like to use Mike as an example so nobody will think I'm picking on them. That little Mike threw up when he ate shrimp doesn't mean little Maria is going to throw up when she eats shrimp. Everybody is different. And then the second thing is that if a diagnosis wasn't really made that the vaccine caused the illness, then the mother is just being emotional and will need some counseling. But unfortunately, if she didn't get enough counseling and guidance after whatever happened to the child happened, that could lead her to assume that, vaccines made her child become disabled or paralyzed.
Okay.
But yes, that can happen if it's not administered properly, if what was given was wrong, because as you know, the healthcare environment is a high-risk environment.
Okay.
I've been witness in a different country where a child was supposed to get a local anesthetic, and instead the person giving the injection gave formalin into the skin and it necrosed the child's finger.
Okay.
So healthcare environment is a high risk environment. We really don't know what happened with this mother. I hope the child is doing fine. But I do think the child's mother needs to be counseled.
Okay.
And so that she can get closure of what happened to her child.
Okay.
And so that the other children can be protected.
What you're saying is that there's no harm at all associated with vaccination. The harm is likely to be associated with the dangers in a hospital environment. Is there no small percentage of people that could face harm from vaccines?
Yes, that's a great question to clarify. I'm not saying that vaccines are 100% safe. Vaccines are safe. They've been tested, researched extensively. Administering it also, there are criteria you want to make sure of. So if all the bottlenecks, all the known areas that increase the risk of vaccines, if they are identified prior to vaccines being administered, then the risk is actually quite negligible.
Yeah.
I often want, when people see the amount of care that goes on behind the scenes before a vaccine is administered, you will marvel. For instance, in our practice at Omega Pediatrics, we have about a 33 step. Before we administer a vaccine, we go through about 33 steps.
Wow. 33 steps.
Yes, by different people to make sure that nothing is missed.
Okay.
Right from when the family comes in, we're checking the name, date of birth, we're going to a state registry, which is not our own record, but an independent record to check, to make sure the name is the same, the date of birth, the parent, the vaccines that they say they've received, the vaccines that are recorded. We check all of that. Not only do we check it, we print it out. Now in our office, we use a lot of soft copies, but for vaccines, we still print out that report from the state. And then it's highlighted, then handed to someone else who reviews it, and then when we talk with the family and they're okay with getting the vaccines, we give them the vaccine information sheet. We bring the sheet back out, then someone else, a medically trained person, writes out the exact vaccines that will be given.
Yeah.
Then another person takes it to the vaccine fridge or freezer, where another person extracts it from the vaccine fridge or freezer and documents it on another piece of paper. Then the person that is going to prepare the vaccine documents the name of the patient as well as their own name and signs and writes which exact vaccines were collected.
Wow.
Then the vaccine is now taken to another person who looks at it and verifies that it is the correct vaccines that is on the vaccine sheet we printed from the state, and it matches the vaccines that the physician has written on the paper should be administered.
Yep.
And then it's now gone and prepared, and they put the needles and all of that, put on their gloves, go in with the paper and confirm that it is the name on the sheet, so it's the right patient, it's the right room, and the parents have given consent. Then the vaccines are administered. And that's not the end. After that, the person that administered the vaccine comes out with everything, takes the stickers from the vaccines, places it on this paper, and then goes back to the state registry to update it with the lot number, the expiration date, and what part of the body the vaccine was given, as well as the time for all the vaccines. After that, that paper is filed, and we go through it every month. Those are the steps we take to prevent vaccine injuries.
Yeah.
And so when you hear us saying we're giving vaccines, nobody's careless about it. And that complications happen due to vaccines, yes, it can happen, just like we have unfavorable outcomes sometimes when people take certain medicines. That doesn't mean those medicines are bad. It just means that something bad happened when they took the medicine.
Yeah.
Either the person reacted to it, or they took too much of a dose, or it wasn't the right medicine, or something. So likewise with vaccines, if you take all the steps to ensure safety and you evaluate the child properly, and it is under the supervision of a physician or at least a nurse practitioner, it's very unlikely you're going to see some of these complications we talk about.
Yeah. Wow. So this information you're giving to parents should provide an assurance to parents that at least given the number of checks, safety checks, that you go through for one particular injection, for one particular vaccine, it's incredible. So it should give parents the assurance that um, safe measures are put in place.
Yes, a lot of safety measures are put in place.
Yeah.
Now, it goes along the same principles that I've built up as a pediatrician, because if, for instance, a child was given Tylenol erroneously, within 4 to 6 hours, it should be out of the system.
Yeah.
But many of these vaccines are for life. So if someone is given a vaccine erroneously, it's going to be in their system for life. So you have to be very, very cautious.
Yeah.
And check as much as double, triple, quadruple check.
Yeah.
Before you administer vaccines.
Okay. So let me go academic here,
Okay.
a little bit. So I just refresh me because I think that parents do need to know this, right? When I was in medical school studying for board exams, it was very important for us to know the vaccine schedules. Oh, a child is born, what vaccines are supposed to be given and what vaccines are not supposed to be given, and what do those vaccines do. 1 month, what particular vaccine? 6 months, what vaccine do you give? 1 year, what vaccines do you give?
Yeah,
Can you talk about those from let's say from birth to
From
1 year?
birth.
Those vaccines and what they do, what they prevent.
Yeah, so that's a great question. It's just the only thing is that a lot of new parents have so much to worry about that I don't know how many will have space to store which vaccines should be given at when. But the common one given at birth here in the US is the hepatitis B vaccine. It's given right at birth. And one of the main reason is that the hepatitis B virus is highly infectious. It's still viable even on a dry surface for up to 7 days. So what that means is that if invariably an actively infected person with hepatitis B virus happens to have a bruise and touch, say, a door handle, or was at a park and had a drop of blood or something touch a surface, that hepatitis B virus particle will remain infectious for up to 7 days. So what that means is that if a child who did not get the hepatitis B vaccine happens to get a scrape on that playground or park bench or something, that's it, they're infected. So that's one of the main reasons why it's given at birth. Now, as with many vaccines, one dose doesn't build enough immunity because it's a very tiny amount, and the body may already start learning how to respond to that virus, but the amount of immunity, so to speak, the amount of immunity that the child would have built from just that one dose may not be enough. So we give a booster between 1 and 2 months of age.
Okay.
Then after about 4 months, at 6-month visit, we give a third dose. So those 3 doses generally help the child have a reasonable amount of immunity against hepatitis B.
Okay.
So that's one of the big ones. That's actually the only vaccine that we give at birth, is the hepatitis B vaccine. All the others start at 2 months of age. So we give the diphtheria, tetanus, pertussis, that's a DTP, the Haemophilus influenza bacteria, HIB vaccine, and then we also give the polio vaccine. That's at 2 months. Then at 4 months, okay, and then also the pneumococcal vaccine.
Okay.
I forgot to mention that that's the Prevnar, that's what it's called. We also give that at 2 months. We give the same vaccines at 4 months and at 6 months to build the boosting. But the Hep B we start at birth to give those. And all these conditions, generally, they're for bacteria apart from the hepatitis. And then the rotavirus vaccine is oral, so it's not an injection. We also give it at 2 months, 4 months, and 6 months, depending on the formulation you're getting. The rotavirus vaccine prevents severe watery diarrhea in infants, because prior to the discovery of the cause of diarrhea in infants, a lot of children had a lot of diarrhea in the first year of life, and many died from dehydration or malnutrition until the vaccine was discovered. So once we give it, it helps the child not have diarrhea as a problem in their first year of life, infectious diarrhea, which is commonly caused by rotavirus. So those are the vaccines that we give in the first year of life. After the 6-month visit, there are no vaccines really on the schedule until they turn 1 year, apart from the seasonal influenza vaccine. Remember, seasonal influenza vaccine is different from Haemophilus influenza B vaccine. Seasonal flu vaccine is like the flu shot that we give every year, and it's a antivirus vaccine, whereas the Haemophilus influenza B vaccine is antibacterial. And it's a routine vaccine, it's not seasonal. The child gets it in the first year of life and then a booster later. So sometimes parents mix those up, but they're two different vaccines.
Okay, good. So at 1 year, what do we give?
At 1 year, according to the schedule, we'll give the measles, mumps, rubella, the varicella, the hepatitis A, the pneumococcal booster.
Okay.
And then at 15 months, we also give the D.O.D booster, which is the diphtheria, tetanus, acellular pertussis booster.
Okay.
At 15 months.
For young adults going back to college, what vaccine do we give them?
Now, generally, we expect that they would have been getting their vaccines right from childhood.
Okay.
So we'll want to give them a booster of the tetanus, make sure they got that at least by the time they're 11, 12 years old, and then the meningitis vaccines.
Okay, meningitis.
Yes, meningitis vaccines. The Menactra, which handles 4 strains, AC, the strain A, C, W, and Y.
Okay.
And then the Men B, which is a different strain, we also give that at 16 years.
Okay.
So that the children are protected from meningitis, because the few times that we've had meningitis in the last 15, 20 years, it's mainly been in children in that teenage, young adult age group.
Yeah.
So it's important. Now, the HPV vaccine is the first vaccine that has been said to prevent cancer.
Okay.
And we also recommend that children get it. Initially, we used to give, I believe, 3 doses, but in 2017, it was changed, and we now give just 2 doses to teenagers, so that by the time they're going into adulthood, they are protected against HPV virus, human papilloma virus, which is a known associate of cervical and genital cancers, as well as throat cancers.
Okay, thank you. So, Dr. Waneri, thank you for answering these questions or educating us on vaccines. So let me shift gear and go into another question.